Hi, thank you for joining us on our media briefing today. If you are not speaking, if you could mute yourself, we've got a lot of ambient noise going on in the background. Thanks very much. So today we have a bit of a special briefing because we're going to really focus on a very important topic. We hear about the flu every year, how important it is to get our flu shot, but with the specter of COVID-19, it makes discussion about the flu even more important. And today we're joined by 4 health experts from our local hospitals who are really coming together to talk about how important it is to take the flu seriously this year. And so we're going to get started with Dr. Martha Blum. She's Medical Director, Infection Prevention with Community Hospital of the Monterey Peninsula, and she's going to start off the discussion today. Good afternoon, Dr. Blum.
Good afternoon. Can everyone hear me?
Sure can.
Oh, terrific. It's a pleasure to speak with everyone and continue to provide hopefully some very helpful and valuable information to the community. I'm going to lead off with talking a bit about the symptoms of flu and particularly how they may be different from COVID-19, talk about who's vulnerable, what the flu usually does to our community in terms of the number of illnesses and deaths, and when can we expect flu to arrive and how long will it stay? So I just want to emphasize the best way for people to prepare is to know exactly what the symptoms are, know if you're more vulnerable, and take all the proper precautions to protect yourself and your family. So seasonal flu is just that. It's seasonal. It follows a fairly predictable pattern as it spreads from the East Coast to the West Coast across our country every single year. That's why we have a fairly defined flu season. Here, it starts around about the end of October, first week of November, and technically lasts until the end of April. So we actually have a well-defined flu season. In our area, we usually hit peak flu-related activity and illness around the end of January. And in the last several years, we have in particularly seen sharp increases around holiday time, particularly starting the last week of December. I just want to try and see if people remember back to 2018, the week between Christmas and New Year's, we saw an absolute explosion in influenza activity. And again, this highlights how just like coronavirus, it's spread by close contact and large family and gatherings. So that's how the flu season generally unfolds. Now, the symptoms are very similar to coronavirus infection, and in fact, the symptoms overlap a great deal, primarily fevers, shortness of breath, dry cough, body aches, and to a lesser degree, stomach symptoms like upset stomach and diarrhea, sore throat, fatigue, and runny nose. So there's really not going to be any definitive way to tell whether your symptoms are from influenza or coronavirus or perhaps some other respiratory virus unless you get a test done. There are a few slight differences that may indicate that you more likely have influenza, and that's influenza has a very rapid onset, very sudden onset. People describe 1 minute they were feeling just fine, they were at work, they were doing just great, and then within an hour, they started to feel absolutely miserable, high fever, felt like they were so achy they couldn't move. So the rapid and sudden onset is pretty typical for flu, but is not typical at all for coronavirus, which tends to be a far more progressive, slowly developing illness. The other thing to note is that the loss of taste and smell is very particular to coronavirus. That does not seem to happen with influenza. And of course, if you have close contact with another sick person, that's highly suggestive that you have one of these respiratory viruses. So those are all the symptoms people should be looking out for. Now, the people who need to take extra precautions are those who are more vulnerable. And for both of these, it's particularly people over 65 with chronic medical conditions like asthma, diabetes, COPD, like emphysema, or people who have compromised immune systems. Both viruses can affect pregnant women more severely, but one difference is that influenza in particularly can cause severe disease in young children. That does not appear to be the case with coronavirus, but with influenza, it's very important for young children to be vaccinated and take proper precautions to prevent being exposed. Last thing, every year we see literally millions of Americans come down with influenza and influenza-like illnesses. It causes hundreds of thousands of clinic visits and hundreds of thousands of hospitalizations. And every year influenza kills tens of thousands of people. Some years it can be as high as 60,000 people die of influenza. That was how it was in that terrible 2017, 2018 flu season we had just a couple years ago. So again, everybody needs to, other experts will talk about how to protect yourself, but it's really something to be taken very seriously, as it can cause quite a lot of illness, hospitalizations, and death. So thanks everyone, and I'll pass it to the next expert.
Thank you, and please stay on the line. Hopefully we'll have some questions for everyone when all the presenters are finished. Next, we've got Carla Spencer, a registered nurse with Salinas Valley Memorial Healthcare System. She's going to talk about prevention and also what everybody's talking about, vaccine.
Thank you so much, and I am happy to be here, and thank you all for being here as well. So just to talk a little bit about prevention, there's something on everybody's mind is, should I get a flu vaccine? And the answer is absolutely yes, because like Dr. Blum said, this is something that we get every year, and we know it's going to come again this year. And so whatever we could do to protect ourselves and give us a little added benefit, the flu vaccine does do that. So you should get the flu vaccine, and you should get it now. In terms of preventative measures, I think we're at a unique advantage this year. With all of the things that we've been doing for COVID, will also help us with combating the flu virus as well. And that's masking and washing your hands and maintaining physical distance between others. That will all help in to stop the spread of the flu virus as well. In terms of the hospitals and flu and COVID, I know that there's lots of questions in how the hospitals are going to handle both flu and COVID. And I want to just ease everybody's minds and say that, flu is definitely something we plan for every year in the hospital. We we get more staffing, we prepare our units. And so we've done a lot of that this year with COVID. And so we are ready to deal with both flu and COVID. We are, finalizing our testing plans. We have test kits for both COVID and flu. And so we are ready to kind of be able to distinguish which viruses do come when patients do come to the ER or have to be admitted to the hospital. We have testing available that we could find out what virus they may have. So really the message here in prevention is what we're already doing, and that's for everybody to do their part and maintain the distancing, mask, wash your hands very well, and then also get your flu vaccine. And there are several flu clinics. I know that Salinas Valley Memorial Healthcare System is hosting one at Taylor Farms Family Health and Wellness Center in Gonzales this coming Saturday from 11 to 2. And then I know there's also a pretty long list on the Monterey County Health Department website that talks about different flu clinics around the community. So get vaccinated and keep doing your part, and we should hopefully get through flu season all staying well.
Thank you. Well, that is hope, isn't it? And now we're going to move from prevention to what to do when you need to get help, or when to know when you need help. And we're joined by Dr. Craig Walls, Chief Medical Officer of Natividad, to touch on that. Hi, Dr. Walls.
Hi, folks. Thanks for having me. A great turnout today. Nice to see everybody here. So really what it comes down to is, if you feel your symptoms are serious, we don't want you to avoid seeing your doctor, coming to an emergency department, or if you feel it's necessary, call 911. Some of the symptoms that we worry about are severe shortness of breath, chest pain, confusion, what we call altered mental status, maybe trouble staying awake at a time that you would normally be able to stay awake, blue color to the lips or the face. Those are all concerning symptoms. And I want to reassure folks that the emergency departments of all 4 hospitals in Monterey are safe places to be. We've done a lot of preparation. We have personal protective equipment. We have ways to separate folks that may be infectious from those that aren't. And the key message here is we don't want you to delay care and let something that might be very treatable go without treatment because of an undue concern about risk being in the emergency department. Our emergency departments are safe. We've proven that. There's a lot of work gone into it. And I think all 4 hospitals are really well prepared to see you if you feel you need to be seen.
All right, thank you. And then, so then we're going to move to what do you do when you are sick? Now, what do you do after you're sick? And for that, we're joined by Dr. Nasreen Karisha, infectious disease specialist at Me Memorial Hospital. And take us on the last leg of the flu journey for people with quarantine.
So rules of quarantine. The first thing is you have symptoms. And we both know that symptoms of the influenza and COVID are very similar. And they share the same symptoms of fever, shortness of breath, cough, fatigue, and weakness. So why should you quarantine? Because we need first rapid identification of those cases, and we also want to separate those persons from the rest of the community. And then, so who should be quarantined? The first thing is, are you in contact with someone who has symptoms, a probable case or a confirmed case, either of the flu or the COVID, or you don't know? And what does that mean? It means within 1 year of someone who has symptoms and for more than 15 minutes. Or you came in direct contact with someone who has symptoms, or you taking care of someone who has symptoms. Now, what should you do if that happens? You have to be in a room by yourself, and this room should be well ventilated, and there should be good air ventilation, taking into consideration the airflow and the air distribution. If you cannot be in a room by yourself and you have to share a house with someone else, you have to be within 1 meter of everyone else in your house. And you shouldn't share like the kitchen and the bathroom, or if you have to, they have to be well ventilated, as I said. There should be enough food, enough water, and if the quarantine is happening at a medical facility, like for example, a nursing home, there should be infection control measures, enough protective equipment, and then we should monitor those individuals. And then last but not least, when there is an executive order to quarantine, a federal executive order to quarantine, it is like, it can be punished by imprisonment and fines, and it will be enforced. So that was the last bit. And then we have so many myths about the influenza vaccine. The first one is, does it cause autism? And so many studies they have been done, and it does not cause autism whatsoever. And they actually did a study where they did the antibody reaction to both groups of kids who have autism and kids who don't have autism. And they gave the influenza vaccine and several other vaccines to those kids, and the antibody reaction to both groups was the same. Also, there was some preservative in those vaccines that were thought to have caused autism, but it was like a mercury-based preservative. Studies have found not only it does not cause autism, but those substances, they have been removed from all vaccinations. Another myth that I hear all the time, pregnancy and influenza vaccine, I shouldn't take it because I'm pregnant, is the opposite. If you are pregnant, your immune system is suppressed and you should take the influenza vaccine. Another common one I hear all the time, I got the influenza vaccine, but I got sick anyways. Yes, because there are several strains of the influenza virus and you got vaccinated. So you could still get sick, but it will protect you, and the chances are higher that you won't get the actual influenza. But yes, you can still get sick. So there are so many myths around the influenza vaccine, and all of them are wrong.
All right, thank you very much. We're going to take a quick break from flu because we've got Karen Smith, our health department PIO, on the line today. There were some changes to state guidance yesterday, and we're going to sneak her in here on the briefing to talk about what modifications the state announced yesterday.
Well, hello. So yesterday, the state announced some changes to pro sports and amusement parks, which is not what we're excited about, perhaps in Monterey County. What we're more excited about, I guess, depending on who you are, is personal care services. So prior to this, personal care services had been shut down, such as massage, or they had to be outside, massage, body art, electrology, esthetician. Okay, that I can't say. The facial stuff, skincare services have been outside or closed. And with the new guidance that was released yesterday, those are all open inside with, of course, some additional considerations and modifications. So that's available on the state's website, covid19.ca.gov. And so that's the big news.
All right, thank you, Karen. I know sorry we had to divert a little bit, but we do have a lot of questions about what is happening at the state level with guidance, and that was big news yesterday. So now we're going to start with questions for our health experts, and I've got a couple in chat, and I'm going to read them just for the benefit of everybody we have people watching on several different platforms. So, and I'm going to let you experts decide who is going to be the best person to answer these questions. If someone has symptoms and is not sure if it's coronavirus or influenza, do you recommend they get tested for COVID-19?
I can take that.
Go ahead.
So yes, because right now we need to identify all the cases of COVID, and we want to make sure they don't spread it to the community. So I most definitely would recommend that they would get tested for the flu and the COVID, so we can know what's going on, and if they are tested positive, they have to quarantine and they have to follow all the precautions. So the answer is yes.
I'd like to add to that, the other reason to get tested is that we do have antiviral medications that are FDA approved and can be beneficial to people who have influenza. But the important part is that you need to know that you have influenza and that you get started on treatment right away. Like I said, influenza has a very abrupt onset. It happens very suddenly, but you need to start treatment within 24 to 48 hours for it to be effective. So there would be a compelling reason to go and get the test and make contact with a medical provider so that if you would be eligible for treatment, you could get on treatment as soon as possible. And also to reiterate that if you know that, then you need to take the precautions to isolate yourself so that you don't spread it around the community.
All right, thank you. And then here's another question for the four of you. Are staff, hospital staff encouraged to get the flu shot? And if so, what has their response to that been? Is there any pushback from staff not wanting to get a flu shot?
I could take this one. So, you know, I could speak for all the hospitals. We have a mandatory policy that we do get flu shots here at the hospital. So it's mandatory every year for staff. Staff can decline it. In the past, if you've declined the flu shot, you've had to wear a mask through flu season when you're in any patient care area. So that has not changed. However, we are wearing masks now. We are still seeing a large amount of staff getting flu shots. So, you know, there were some questions in the beginning, but we're definitely still seeing a good compliance rate with staff in getting the flu shots in the hospital.
Yeah, I think that's right on, Carla. You know, I think this year more than ever, folks are lined up and eager to get their flu shot. I certainly was, and all the colleagues that I work with. Really no significant pushback. And I think this is because if you've seen someone that's real sick with the flu, and if you understand how good the flu shot is, how well it works, how safe it is, you know, you're going to be lining up to get that flu shot. And we've had tremendous response, I know, at all the hospitals. And I think the public needs to know that your healthcare professionals love the flu shot.
At Community Hospital, we started our staff vaccination at the end of September, and there was immediate and very robust response. Within the first 2 weeks, I think we vaccinated almost half of our staff. I mean, everybody just poured out immediately to come and get vaccinated. So we're doing very well, and we try to get everybody vaccinated by the end of October so that we're all protected from the flu going into flu season.
Boy, if that's not an advertisement for the flu shot, I don't know what is. So here's another question. It's directed to Natividad, but I think this is a good question for all the hospitals. Does Natividad and, of course, the other hospitals have the resources to assist patients with COVID and flu, such as sufficient beds and PPE?
Yes. We got beds, we got PPE, we got folks with training. We're geared up, we're ready. Again, I don't necessarily want to speak for my colleague hospitals, but I know that they are too. We're ready, we've been ready, we'll be ready. And the answer, if I didn't say it earlier, is yes.
Yes.
Okay, can I get 4 yeses?
Yes, Community Hospital is ready.
Yes. Yes, we are ready.
We are.
Thank you. Another question for you, COVID-wise, and this is for Me Memorial. Is Me Memorial seeing an outbreak of sorts of COVID-19 at the hospital?
I haven't seen any outbreak at this time of COVID-19.
All right. And another question for you. Could you confirm there are COVID positive patients or deaths on your skilled nursing unit?
Let me check on that and get back to you.
Okay. I'm going to jump back to a question that came through for Karen. I'm hoping you're still on the line. Is there a capacity limit for tattoo parlors and the other personal services allowed to open indoors now?
Yes, and it's not specific. I haven't really been able to scour the guidance, but clearly the 6 feet rule and the rule of thumb is 25%.
All right, thank you.
Capacity.
And that is all the questions that I have in chat for our presenters today. I'm going to give a second or two for anyone who has a question that they would like to ask. These guys, you guys are so thorough. I think you've stunned them into silence with dazzling them with information. Seeing no other questions coming in, thank you all for joining on the media briefing and really giving a thorough look at flu and how it relates to COVID and reassuring everyone that you all are ready. Thanks everyone for joining us on the media briefing this week. Our next briefing will be next week, and we'll see you then. Good afternoon, everyone.